So I hope I don't beat this up too much, but you know, I'm going to be giving a number of presentations. And as I was visiting with another participant at the break, you know, I really looked for ways to improve outcomes regarding cystectomy. And one of the things that I really want to sort of emphasize is that I really am sort of looking for easy things that we can do, things that I can actually modify or intervene on and make a difference right off of the bat. Nicole mentioned, or actually Uno, I think, was talking a lot about frailty, and there's a lot of data about frailty in bladder cancer patients, but we can't oftentimes do a lot of things about that, particularly in the time period that we have. So I really sort of tried to focus on, well, what are some short interventions that perhaps could make a difference in our patient population? And so I'll tell a story about one of our investigators in a minute, but right now I'm going to talk about immunonutrition and the role of what's called specialized immunonutrition in bladder cancer. And a trial, and I'm going to be putting in a shameless plug for our SWOG trial that we have ongoing right now. So here's a picture of the University of Kansas Health System. This is our hospital. Of course, for those of you who may or may not know, University of Kansas, which is about 30 to 45 minutes away in Lawrence, Kansas, has a very strong and proud tradition of basketball. In fact, Naismith was our first coach who wrote the rules of basketball, and those are now enshrined at Allen Fieldhouse, and so you can actually go and visit those. And we've had a number of national championships, and up on the left is Wilt Chamberlain, probably one of the most famous basketball players of all time, who played at the University of Kansas. So again, a very proud tradition of basketball at Kansas. More recently, not so much a proud tradition of basketball at Kansas. Anybody that saw this was a brawl between Kansas State and Kansas, and of course there's no love lost between those two schools. And this is D'Souza, who got involved in this squabble and picked up a chair like it was a WWF competition. Like he was going to beat somebody over the head with it. Fortunately, somebody else took it away. But if you're ever just wanting to spend a few minutes on Google and have a good laugh, Google all the different people around and their expressions. The worst was that's where all the handicapped people sat. And there are these people in wheelchairs that are just, they can't do anything, and they're in the middle of this melee, and it was a real disaster. So anyway, so it's not so proud tradition recently. So, one of the problems with radical cystectomy is that it is underutilized, and we have a number of studies that show that patients who should be receiving radical cystectomy oftentimes do not. That is very true based on age. So the older the patient gets, the less likely they are to get a radical cystectomy, even though, again, that might be the recommended treatment option. And one of the reasons for that, obviously, is significant problem with complications. So how can we improve utilization of radical cystectomy? Well, let's decrease complications. That's one way. So if we can make it easier for patients, if we can make it safer for patients, I think we could probably increase the utilization of radical cystectomy in our populations. Again, high complication rates, rapid muscle wasting and defunctionalization. I've already talked about cachexia, so I won't talk more about that right now. And of course, many of these people do come in with poor preoperative nutrition statuses. There is a significant amount of data that shows that patients with poor nutritional status before cystectomy have worse outcomes after radical cystectomy. And this was data from one of the residents at Vanderbilt back in 2011. There's other data, and I would point you one thing that's really unique, and I'll show you on the next slide as well, is that the colorectal folks have really kind of led the way for us in many of these things, whether that's ARIS pathways or SIM or a number of things. So if you're really kind of trying to say, well, what are some ideas, read the colorectal literature. My sort of take is colorectal's been first, we're second, gyn-onc is a little bit behind us in sort of implementing many of these things. But one of the things that we've known from the colorectal literature is that arginine, which is an essential amino acid, gets depleted during surgery or surgical trauma. And I'll talk about why that's important in a minute. But there is previous data showing that it's important for immune function. And then there are previous studies that do suggest that utilizing supplements, we can reduce infections. And again, that was in the colorectal literature. So one of the things that happened in sort of earlier in my career was we had recruited a PhD dietitian from the University of Minnesota. And at that point in time, she was very interested in looking at some soy derivatives, genistein and diazine, and their effect in prostate cancer. And so my former boss, many of you all know, Dr. Thrasher, sort of said, well, Jeff, you need to go meet with her. Go meet with her and talk with her and help her out. And so I started meeting with her, and we were talking, and I just kept saying, yeah, that's interesting, but can you help my cystectomy patients not lose so much weight? Like, they all lose weight. They're all so sick. Can we look at that? So finally I convinced her, well, let's look at the data. So she needed some convincing, and we looked at our own data. And again, this is from 2011, 2013. And we looked at how many of our patients maintained their weight versus those who had significant waist loss and cachexia. And I showed her that, in fact, 2/3 of our patients lose significant amount of weights, and that was associated with much worse outcomes. So this really started the project rolling where she and I collaborated together. As I mentioned, there are a number of randomized controlled trials looking at supplemental drinks, and again, those have all mainly been in the colorectal literature, all of which, mainly, not all these studies, have shown reduced complication rates or reduced infection rates. So the first study that was done, a pilot study, this was done in Europe by Bertrand and colleagues, and they were able to use a specialized immunomodulating drink and show that they were able to reduce the 30-day complication rate. They had lower infections, and they had lower rates of ileus. And so this led to our pilot trial, and this I did with our PhD dietitian, Jill Hamilton-Reeves, where we gave a specialized immunomodulating drink. And I gave that to patients perioperatively around cystectomy, and we were able to show that we were, in fact, able to reduce infectious complications after radical cystectomy. And I'm going to show you some basic science data in a minute of why we think that happens. I will pause here for just a minute because I do want, hopefully, to have some take-home messages for the participants of this thing. This is not something super crazy. This is a commercially available drink called Nestle Impact Recovery. I have no financial relationship to them. In fact, they've been a pain in our butt, quite honestly. But this specialized immunomodulating drink is available. So if you wanted to tell your patients, order it on Amazon, they can do it. And it is fortified in arginine, omega-3 fatty acids, and some vitamin A and nucleotides. Those are the added ingredients over what are just regularly available supplements. So Nestle has another supplement just called Nestle Impact. Of course, there's Boost, there's Ensure, but the Impact Recovery has those additional things added to it. The only downside of it is that omega-3 fatty acid, as you might know, has a little bit of a fishy taste, so you just need to warn patients a little bit about that prior to surgery. So why would this improve outcomes? Well, one of the things that we know happens around surgical trauma and around major surgeries is that you get expansion of the myeloid-derived suppressor cells. And that is associated with bad inflammation. We know there's good inflammation, bad inflammation, and the expansion of MDSCs has been shown to increase the rates of infection. Well, what is the reason that MDSCs expand so rapidly is that there's depletion of arginine. So the arginine is utilized after major surgery and the MDSCs expand. And what we were able to demonstrate is by replacing arginine, we had less expansion of MDSCs, and that is one of our theories about why we were able to show reduced infections. And again, you can just see the rates of the specialized immunomodulating drink versus a regular supplement in terms of the use of antibiotics, which was our sort of surrogate endpoint for infectious complications. In terms of weight loss and cachexia, we also saw significant improvements in patients who were on the SIM versus the regular supplement. Those patients on the SIM had less weight loss, had less skeletal muscle loss, and one of the mechanisms about cachexia, the reason that may happen is that you have interleukin 6 that significantly that is involved in this process. And so by giving this specialized immunomodulating drink, again, we were able to modulate interleukin 6. And again, that may lead to decreased rates of cachexia and immunonutrition. So we've worked with an immunologist, and these are some of the mechanisms by which we believe this drink is working. There's also this Th1, Th2 balance. And we have data that shows that after major surgeries, that balance can get skewed, and that's towards the Th2, and that may be associated with worse outcomes. But with the addition of the omega-3 fatty acids, as well as some of the nucleotides, again, we may be able to modify that balance and, again, reduce infectious complications and weight loss after surgery. So, again, these are some of the basic science correlates that explain why we believe this may be working. I mentioned this a little bit more, and that was when we looked at our weight loss and skeletal muscle mass. And one of the things that's unique about this trial and the way we've done this is we're measuring skeletal muscle mass by DEXA scan. So a very, very precise way of measuring skeletal muscle, not using the Slice-O-Matic or the SOAs. We're actually doing this with DEXA scanners, and that's been a really good way. And what we again have demonstrated is that those patients who received the specialized immunomodulating drink had less skeletal muscle loss, less cachexia than those who received just a regular supplement. Now, I keep talking about this regular supplement, and that was because we did not feel it was ethical to give a supplement and not give something to the other patients. And so we gave all patients that opportunity to have a supplement. One just had the specialized immunomodulating drink. So this is Jill Hamilton-Reeves. Jill is my co-PI on this trial. This is a SWOG trial called SIMMUNE. SIMMUNE, the SIM stands for the specialized immunomodulating drink. The immune means the modulation of the immune system. And this is sort of, again, the theory behind this about why we believe this may work and why we think that we can decrease complications by modifying many of these aspects. So this is our trial. And the way that it works is that patients are enrolled in the trial. They start the specialized immunomodulating drink 5 days prior to surgery. They then undergo the surgery, and then they're started back on the drink immediately post-operatively, again for 5 days. And then we're going to be monitoring complications. I'll show you a list again of the things that we're going to be monitoring. One of the things, the challenges that we had a little bit when we first started this trial is that patients after radical cystectomy are crazy thirsty, right? They always want to just slurp something down. And we did find that with this drink, whether it was the regular supplement or the specialized immunomodulating drink, if you let them just slurp it down, they'll throw up. So what we had to do was keep it on ice, have them sip it slowly. We had to say, try to drink this throughout the day, and that way we were able to get that in, and we didn't have as many problems with people throwing up right after sucking one of these down. So that was an important point of this. So again, as I mentioned, these are some of our endpoints that we're sort of looking at. We're looking at infectious complications. We're looking at skeletal muscle wasting as measured by DEXA scan, 90-day postoperative complications, readmission rates, quality of life, disease-free survival, and overall survival are some of the endpoints that we'll be looking at. Again, here's the schema. I won't belabor this because we've already talked about this. Again, it's a randomized trial. They either go to the specialized immunomodulating drink or they go to the regular supplement. When we first did our original trial, we just purchased the product and then we wrapped it up in red duct tape so they couldn't know which one they were getting. And ultimately, they probably could have if they knew they were getting the fishy taste, but they didn't know what the other one tasted like. So that's how we were able to blind the study. Here are some of the site requirements that we have. So you do have to be following ARIS principles. We don't do bowel preps, and that is one of the guiding principles of ARIS. You have to avoid NG tube, at least immediately post-operatively, because they have to be able to drink this down. You do have to allow early oral intake. We want to minimize narcotics, and again, that's a sort of basic tenet of ARIS principles. And then you have to have a DEXA scanner. For our eligibility criteria, it's basically any adult who is scheduled to go radical cystectomy for primary bladder cancer. And you can see, I won't go over all the exclusion criteria, but you can see all the exclusion criteria for those patients as well. Again, here is sort of the treatment plan. They're randomized. They do undergo a this is called the PGSGA, which looks at their nutritional status prior to radical cystectomy. They undergo that. Again, we look at quality of life questionnaires as well. And then again, they start the drink 5 days prior and then continue after surgery as well. We are, again, continuing to track nutritional status, body composition, as I mentioned, with DEXA scan, and then quality of life surveys, and then looking at surgical complications. So, in summary, the SIMMUNE trial we feel is sort of it's a pretty easy intervention. This is nothing earth-shattering. We think that, though, this is something that could be done, implemented across the broad spectrum of cystectomy and help improve outcomes around radical cystectomy. If you look at the guidelines for the muscle-invasive bladder cancer, they just sort of had this broad statement that physicians should sort of optimize patients prior to surgery. And of course, we feel like this maybe is in line with those goals as well. So with that, I will conclude this talk. Thank you very much.